I am a soil scientist that works with metal contaminants. I've worked for 30 years on this, starting actually years ago with the effect of cropping systems on metal absorption in soils. Who would have known that cropping systems are so important? That 30 years ago I did my thesis on that, right? And so, but now, since then, I've been working on Superfund sites, brownfield sites, and recently on urban sites for metals. I've had the privilege of, I've got actually a courtesy appointment in public health at OSU, and I've had the courtesy, in this latest project I finished was working with two toxicologists from NERL and NHREL at RTP, and sorry about the acronyms. So, I'm just talking like them now. And from USDA, we had a collaborator. One more, Oak Ridge. I'll use Oak Ridge instead of O, R, and L. Okay, so, and so I've kind of sent my students to take, Cassray and O'Doul's toxicology, make them learn at least to be able to not make toxicologists out of them, but understand it. So I'm really happy to have public health here, people to talk with. So the one thing I want everyone to remember what I'm going to talk about today is bioavailability drives the world. That's the concept. Metal or metalloid, if we're talking about arsenic bioavailability, we should come up with a soil health framework that looks at metal bioavailability. And what is bioavailability? It's the form of the metal. It gets absorbed by plants. If you eat the plant, it's the form if it gets absorbed into your blood. If it's not bioavailable, it's not going to be of harm. Okay. And everything I say today about contaminants, by the way, this could be nutrients too, but I was asked to talk about contaminants because some metals are nutrients. Okay. The second point is that we have soil health assessments. We do it all the time. We look at organic carbon, pH, management practices that are recommended, whether they be cropping practices or soil amendments to improve. And some of these actually are able to decrease transmission of metals from soils to people, to children, or in urban environments, to decrease the bioavailability. So what we don't know exactly is to quantify that. We'll say, well, add organic matter, it should reduce the bioavailability of metal. How much? What form? You got to know the bioavailability, right? So it all goes back to bioavailability. So we have to be, so the metal absorption of people are well known. The information gap is the soil health practices that we need to institute, and we are instituting, to quantitatively decrease the absorption essentially by human populations, especially children. The last point is a little different, and that is the consumption of produce, the ability of freshly grown produce in urban areas to actually mitigate or reduce the bioavailability of those metal contaminants or ingested soil. We have people who are afraid now to garden in urban soils because there might be contaminants there. However, if they eat these fresh vegetables, they probably won't have any, it's a protection from contaminant absorption. So we should be promoting they actually not be heavily contaminated, but if there is some lead, which there is in the environment, there's going to be a prophylactic thing on produce produced. Eating cauliflower, eating these things, which ones, we've been doing studies on which vegetables reduce metal bioavailability the most. And it's impressive. I mean, you see bioavailability go from 60% to 2%. So that's something we need to include to get people over the hump of being afraid of their soils. Let's go to the next. Oh, I change it?
Yeah, the
The green
green button.
button, okay. Okay, so can you see that whole slide, or is it cutting off the edge?
They can see.
Okay, all right. So basically, soils come in many flavors and colors, and you put metal into them, and they partition the metal, the properties in the soil, the carbon, the pH, soil amendments, partition it into available forms and unavailable forms. The available are the ones I'm talking about being bioavailable. Why is that important? Take a look at the picture of the lettuce. They all contain the same amount of lead, 2,000 parts per million. The ones that have the high metal bioavailability are dead. There's no lettuce growth at all. And the ones that do have the low metal availability are living. Now, is that good? Should we eat that lettuce? I don't know. Maybe it's better that they're dead. But I mean the point here is if a regulator says to me, 2,000 parts per million lead, is that a good standard? I'm going to say, for what? for growing lettuce? Oh, I don't know. Depends what soil you're in. If it's something that absorbs the metal, you could probably grow the plant fine and eat the tomatoes. If it's another one, you're not going to even grow tomatoes. So we really, if we measured metal bioavailability, that one number would tell us yes or no. Okay. Guess what? That works for ingestion. The bottom slide is juvenile swine. Soil fed to juvenile swine, and on the x-axis is the percent of arsenic that's absorbed by the iron oxide in the soil. Okay? And you see an inverse relationship. So we take this contaminated soil with arsenic, and we feed it to these juvenile swine with Dr. Castile's lab down at University of Missouri. It's the SOP for children. And they don't absorb it if there's high iron oxide. It actually goes through the GI tract. This is the soil ingestion exposure pathway. By the way, I'm all about exposure pathways. And so, so why are we using juvenile swine? Because we can't use children. And they tell me that little pigs are very similar to children, at least with the gastrointestinal tract, okay? So, okay. So the idea is soil health practices can reduce the contaminants, and may enhance the good metal bioavailability. But then you got this produce coming in too. That interaction between the soil and the ingestion of produce will have even a bigger effect on the bioavailability. And by the way, the in vitro bioaccessible, those beakers, that's simulated stomach fluid. We simulate in our lab stomach fluid and intestinal fluid. And we're known internationally for this for contaminants, lead, arsenic, and cadmium. We've correlated with the animal studies. We've done the expensive studies. The tests are $35 each. The animal dosing study for swine is $30,000. Okay, so the next step is in the GI tract, does it go across the epithelium into the blood? And that's where you affect on human health. So what's the research topic? Decreasing, I'm thinking we need criteria for decreasing toxic metal exposure in soil environments to children. I think we need to quantify the practices. If we tell people that they should add organic matter, we should be able to tell them what kind and how much to reduce or be protective. I think the other thing is determine a modifying effect from diet. And to do that, really the best way to do that is to get someone in nutrition that actually works with CACO2, cell line models or animal models. And I noticed that we do have someone who does CACO2 here earlier from, yep, CACO2. So CACO2 is great. It's the closest you can come to people without using them. Or you can use mouse or swine. So what is the output? What do I see the output? We need to incorporate metals, beneficial and not beneficial, into some kind of framework for human health production, research that leads to that. So I can pick up the soil health assessments that I teach in my class, right? And there's a metal section that makes sense on bioavailability, okay? And then we can encourage people to use these practices. Benefits of urban ag products, subject matter expertise, well, of course you need me, right? So the soil environmental chemist, right? And then somebody who could do CACO2 or animal models. I put down Dr. Grusak, possibly, I don't know. But, you know, other people too. We do work with environmental sociologists and community people when we work in urban agricultures. Money is welcome, right? Where could we get it? Well, there's a new initiative out, urban agricultural initiative under USDA NIFA last year in the Farm Bill. Senator Brown's a big supporter. Debbie Stavanoff, I believe, sponsored this. NIHS, if you really want to do some good basic research, NIHS would be a good place to go. The one thing I've been hearing, and I'll just mention, is everyone's going to ask for 10 million. And what you really need to have is some holistic studies, some big sites that do holistic studies that everybody can make measurements on. So I can come and make my measurements on. So what you really need is to pick some systems that are used, recommended by soil health, that are worthy of study. And there are some urban sites out there. In fact, I was talking to the professor from Johns Hopkins. I can't remember your name right now. Yep. And he's talking about 5 sites, urban sites. What a great idea. So you establish the locations, and then you make everybody come take their measurements at those locations. And that would really cut down the cost, and it would make it holistic. You'd be able to look at the effect of this soil health treatment on a whole variety of things holistically. So with that, I'm done. Thanks.